Hello everyone. So, in this lecture we are going to discuss about anti-amoebic drugs. In this lecture we will discuss first what is amoebiasis, then we will see the life cycle of amoeba, then we will discuss the drugs which are used to treat amoebiasis infection. So, let us start with the amoebiasis. This is the disease which is caused by the parasite, and the parasite here is Antiamoeba. The parasite here is Antiamoeba histolytica. Yes, about 10 to 20% of the people who are infected with Antiamoeba histolytica become sick from the infection. Yes, so we will see this amoeba forms. So, there are two forms in which it is existed. Okay, one is the cystic form, cis form, and another is the trophozoite form. Yes, this is the infective form. Now, we will see the amoebiasis. So, it could be of two types. One is invasive amoebiasis and another is non-invasive. Yes, invasive amoebiasis is seen nearly to 10 to 20% of the people. Yes, whereas if we will see the 80% to nearly 90% of the people are with the non-invasive amoebiasis. Yes. Now, it can affect anyone, and although it is more common in people who live in the tropical areas, okay, or tropical areas with these poor sanitary conditions. Okay. So, the most important preventive measure is the health education, improving sanitation. Yes. Now, amoebiasis is common infection of the human gastrointestinal tract. So, the first area which is affected is the GIT, okay, and these amoeba, these parasites, they will affect the intestine area. That intestine starts to rupture. This is the initial phase. Yes, and when the intestine start to rupture, these parasites will start to move to other organs as well. They will reach to the liver, they will reach to the brain, they will reach to the other organs. Okay. At that time it will be severe. Yes. Amoebiasis is more closely related to poor sanitation, which I told you, and socio-economic status than to climate. Of course, climate is one of the favorable condition for the survival of the amoeba, but apart from it, socio-economic condition, okay, how the people are living, okay, what is the social status of the people. So, of course, depending on the social status means they are following the sanitation or not. Now, amoebiasis affects about 15% of Indian population, and it has been reported throughout the India. Yes, a few cases you will get it from everywhere, okay, every part of the India. Now, amoebiasis, the other data is related with it is, in addition to being a potentially lethal disease, invasive amoebiasis has important social and economic consequences. Of course, it is causing the burden on the country, social burden, economic burden. Yes. So, the invasive form, it may require several weeks of hospitalization, yes, and 2 to 3 months for full recovery. Yes, and if it is not done at appropriate stage, of course, the person will die with the weakness or the poor nutrition. Yes. Amoebiasis may cause clinical problems in person. What are the clinical problems? Persons with immunodeficiency, means those people who are their immunity is low, they are more prone for this infection, or homosexuals. Yes. Then the people who are migrating from one place to the another place, they are more exposed with one area to another area. Yes. So, immigrants from certain tropical countries, yes, and who are travelers. So, basically who are traveling from one area to another area, they are exposed for the climate of the other area, and they are more exposed with the these infection. Now, see the life cycle of Antiamoeba histolytica. So, it is ingested, these amoeba is ingested through food or water, yes, which is contaminated. So, human, it is started from this site here, human ingest infective cyst. Very initial I told you there are two forms, trophozoites and cystic form, yes. So, cyst form is infective form. Now, this cyst is present in the fecus, and someone who is affected from the infected person, the fecus is the another person, they have taken it from the contaminated food or water which is touched with that fecus, yes. So, human ingest infective cyst. When the cyst the person will ingest, what would happen? It will reaches to the intestinal area, yes. Now, organism cysts in intestine, asexual reproduction will start in the colon, intestine, yes. So, it will change, this cystic form will change and it will form trophozoites, yes. This is the filamentous form, little bit there is a difference between the cyst or the trophozoite form, this is non-infective, yes. Now, these trophozoites, it undergoes some conversions. So, we can see some conversions here. Either the trophozoite passed in liquid or soft stool, which is not infective, yes. Then we can see these trophozoites can also cause eroding the intestinal wall. So, there will be rupture of the intestinal wall, yes. This area is affected, intestinal area, and they will reach to the other organs, yes. They will reach to the circulatory system, they will reach to the blood, and then from the blood they will reach to the liver, yes. This here it is reaching to the kidney, yes, it is the liver, they are reaching to the liver, and also for other organs as well, okay. They can reach to the brain also. Here we can see hepatic abscess, these abscess formation, this mass formation is there, okay. So, infection can reach to the other areas as well. Now, we are seeing this trophozoite can also undergo the conversion and it can form the cyst, okay. Incyst procedure is there, infective cyst in formed stool, and then from there it can contaminate the soil, okay. And when this soil is touched to the food or a water, whosoever will take it, of course, will get the infection, yes. So, this is the whole cycle here. Now, see what are the drugs which are used for the treatment of amoebiasis. So, drugs effective against infection of Antiamoeba histolytica can be classified in three ways. First is tissue amoebicides. Tissue amoebicides is known as extraintestinal amoebicides, yes. The drug is chloroquine, okay. The second class, the drug which is acting on the intestinal and extraintestinal area, okay. They are known as extra or luminal extraintestinal amoebicides, drugs such as nitroimidazole. Under this, metronidazole, tinidazole, secnidazole or nidazole, yes, emetine, dihydroemetine. Then third class, luminal amoebicides means intestinal amoebicides, which are the target is the intestine area. So, Diloxanide Furoate, Paromomycin, lodoquinol, Quinidochlor, tetracycline, yes. So, there are three classes and the drugs I have mentioned here. Then see, Nitroimidazoles. Under this we have metronidazole, secnidazole or nidazole. They are very effective drug. They are effective orally as well as IV. They are eliminated by hepatic metabolism. And the nitro group which is present in these of the compounds, these of the drug is responsible for the activity. Yes. So, nitro group of these drugs gets bioactivated to form some cytotoxic products. It will form some metabolites which will damage the DNA. Yes. Further, it will lead to the death of the amoeba. Now see, metronidazole is a drug of a choice for intestinal wall disease, means they are working as luminal amoebicides as well as they are working for the amoebic liver abscess. They are working for the extra intestinal amoebiasis. Yes. It is usually combined with a luminal amoebicide, means they intestinal amoebiasis. Yes. This drug is not a very good drug for luminal amoebiasis because it is completely, almost completely absorbed in the proximal intestinal area, proximal part of the intestine. So, very few of it, the few amount is reaches to the colon area, and we are wanting the effect of these drug we are wanting at the colon area. So, the amount which is reaching here is a very small, therefore, it required to be given with the other luminal amoebicide for the effect at the luminal area, yes, intestinal area. So, metronidazole is a drug of a choice for the treatment of infections such as trichomoniasis, giardiasis, bacterial vaginosis and pseudomembranous colitis. Yes, trichomoniasis is one of the infection which is caused by Trichomonas vaginalis. This is affecting the genital area. Then giardiasis is infection which is caused by the Giardia lamblia, affecting the intestinal area. Bacterial vaginosis, overgrowth of the bacteria in the vagina area, and pseudomembranous colitis is affecting the intestine. There is an inflammation of the intestine which is caused by the Clostridium difficile. Yes. It is also used for the treatment of infections by anaerobic bacteria such as bacteroides, Clostridium, and it is used for the treatment of Helicobacter pylori infection which is causing acidity. Yes. So, in combination therapy it can be given in this infection as well. Now, we will see the mechanism of metronidazole. So, see, there is a nitro group present, yes, which is essential for the activity. Inside the microorganism, there will be formation of metabolite. The metabolite with the reduction at 5 nitro group, which is then incorporating, that metabolite is incorporating in the DNA, yes, act on the DNA and will cause the DNA fragmentation. Yes. So, that DNA fragmentation will lead to the death of the microorganism. Now, see what are the side effects of the nitroimidazole drugs. So, nausea, metallic taste, and there are some other antibiotics as well which are giving the metallic taste. Yes. So, metronidazole is one of them which is also giving the metallic taste, nausea, abdominal cramps, they are the common adverse effects. Then it can also cause discoloration of the urine, it will decrease the WBC level, yes, they are affecting our immunity, yes, they are decreasing the levels of WBC. So, they will cause leukopenia and it will cause dizziness. Seizures can also occur, convulsions can also occur if the higher dose is given. Due to the decrease in the WBC levels, which are essential for fighting against infections, there will be chances of some opportunistic fungal infections. Okay. So, if any patient is taking metronidazole for a very longer time, there are chances that the patient is prone for some other infections as well. Okay. Now, the metronidazole, this drug, what it is doing? It is inhibiting alcohol dehydrogenase enzyme. Yes, due to this there is a accumulation of acetaldehyde, yes, which is leading to some of the symptoms as seen with the disulfiram, which is given for the treatment of alcoholics. Yes, so it can cause disulfiram like reaction if used in patients who are taking alcohol. Now, metronidazole is inhibiting one enzyme CYP. Yes, the CYP enzyme, which is essential for the metabolism of warfarin. Yes, coumarins, warfarins, anticoagulants. Now, what would happen? It will inhibit the enzyme which is essential for the metabolism of warfarin. That lead to the delayed metabolism of these coumarins of warfarin lead to the potentiation of the anticoagulant effect. Yes. Other drugs, tinidazole, secnidazole, onidazole, cetrinidazole, they have similar potency, they have similar efficacy, yes, as metronidazole, but there are some exceptions in the activity. So, long acting, but are long acting compared to the these metronidazole, yes, these drugs. Now, secnidazole has a longest half life, yes, so it retain for the body for a longer time. So, compliance can be achieved by this secnidazole better than the some other drugs under this category. Now, cetrinidazole is one drug which is devoid of the effects such as metallic taste, neurological, adverse effects, disulfiram like reaction, yes, means it is not showing these effects. Other drug, Diloxanide Furoate. This is the drug of choice for asymptomatic intestinal amoebiasis, means the patients who are not showing any symptoms of this amoebiasis. For them, this drug can be used. It is used with tissue amoebicides for extraintestinal infections. Yes, drug of choice for carriers. The same I told you, means the persons who have these infection, these amoeba, they have in their body but not showing any symptom. But there is one problem, they are causing flatulence, yes, gas production. Another drug is Emetine. Emetine and dihydroemetine. They are not used much compared to the other drugs, they are rarely used because there is some toxicity associated with Emetine and dihydroemetine. Now, how they are acting? So, they are inhibiting the protein synthesis, yes. They can be used parenterally in injection form in severe hepatic amoebiasis, okay. So, for the cases where the other drugs are not effective, it is reserved for those of the condition, yes. It is not the primary option to treat the disease. Now, toxicity associated with Emetine or the dihydroemetine is emesis, there will be vomiting, muscle weakness, cardiotoxicity, yes, and very severe cardiotoxicity, arrhythmia and congestive heart failure, yes. So, due to toxicity, this Emetine is reserved for those of the condition where the other drugs are not effective. Now, another drug, lodoquinol and Quinidochlor. This is the luminal amoebicides. Yes, they are affecting the intestinal region. They are targeting the intestine area. In large doses, there is problem with these drugs. If taken in large doses, it can affect the thyroid, it can enlarge the thyroid and can damage the neurons. Okay. So, it can cause the peripheral neuropathy. Whenever there is a peripheral neuropathy, neurons will damage. It leads to the auditory impairment, it leads to the optic impairment, yes, eye vision disturbance, ear disturbance, visual disturbance, hearing disturbance, and apart from it, these auditory impairment and optic impairment, other effects such as hallucinations, yes, convulsions. These type of effects are also seen with peripheral neuropathy. Now, Quinidochlor and other 8-hydroxyiodocunolines in high doses can cause eye defects, which is known as subacute myelooptic neuropathy, and short form here is SMON. What it is causing? It is causing blindness. Yes, there will be subacute myelooptic neuropathy. Nerve will damage in the eye area with this drug. Yes. Then Paromomycin. Now, this Paromomycin, this is also forming some free radicals, okay, cytotoxic compounds, cytotoxic metabolites, and it will damage the amoeba microorganism here. Yes. It is an aminoglycoside that can be used as luminal amoebicide for intestinal area. Yes. So, it is affecting intestinal site, targeting the intestinal site. It has some activity against cryptosporidiosis. Yes. This cryptosporidiosis in AIDS patients are also deficient with their immunity. So, they are more prone for some opportunistic infection. Here it is a cryptosporidiosis. Yes. Recently it has been approved for the treatment of Kala Azar, means leishmaniasis or visceral leishmaniasis, yes, caused by leishmania. So, for two other infections here like cryptosporidiosis and Kala Azar, this drug can be preferred. Now, Nitazoxanide, this drug, this is a new drug here. It is a pro drug which needs to be converted into Diloxanide, okay, and it is affecting the enzyme pyruvate ferrodoxine oxidoreductase. Yes, by inhibiting this enzyme, what happens? There will be the energy production will not occur. Yes, so it is essential. This enzyme is essential for the energy production and for the survival of anaerobic organism. So, if it is inhibited, of course, ATP production will not occur. Yes, energy production will not occur. Of course, survival will not be there with these parasites. Yes. So, it has a good activity against this Cryptosporidium parvum. This infection can be, this drug can be preferred for it, and it has some activity for Antiamoebic histolytica amoeba, then vaginalis, Escheriasis, then Nana is one of the dwarf worm infection, and metronidazole resistant giardia, Giardia lamblia, where the intestine is affected and metronidazole is not effective. For that, Nitazoxanide can be given. I hope this is clear to all of you about these drugs, how they can be used to prevent the amoebiasis and what is the life cycle. So, we will meet in the next session. Thank you so much everyone.